You're listening to Honestly Aging by Friends Life Care VigR, a podcast where we explore what it's like getting older, the peaks, the valleys, and everything in between. In this season of Honestly Aging by Friends Life Care VigR, we're covering topics related to solo aging. I'm your host, Cheryl Praska. Let's grow old together. On today's episode, I'm joined again by Darshan Bhatt, who is a physical therapist by trade, is the founder and president of Namaste Rehab, a company that provides therapy services to older adults at their place of residence. Darshan earned a master's degree from University of Buffalo and a doctor of physical therapy degree from Utica University. After seeing the dire need for rehab services for older adults who could not access care during the COVID pandemic, Darshan decided to start his company. Namaste Rehab's motto is, "Why go to the clinic if the clinic can come to you?" Darshan, welcome, and thank you for being here yet again. How are you?
I'm good. Thank you, Cheryl, for having me. It's always a pleasure to be here.
Well, Darshan, you are joining me today, and we're going to talk about bone health. So, as a note to our listeners, if you haven't listened to our last episode with Darshan about home health rehab and physical therapy, I invite you to do so. And for anyone who did not listen to that last episode yet, can you again brief us on your background and your professional experience?
Sure. So I'm a physical therapist. By training, I got my undergraduate physical therapy degree in India, and then I came over here to get my master's from the University of Buffalo, which I completed, and then I got my doctorate in physical therapy, like you mentioned, from Utica University. And then after graduation, I've worked in different settings, from uh, hospital-based to nursing homes to home health. And then home health was the field or the subfield that I felt really resonated with me because it was care that I was providing right in the client's own environment, where I could make the most difference and make them more successful. So here we are. I decided to start a company that does exactly that, and I'm happy that I did it.
All right, well, let's dive on in and let's get started by you providing us with an overview of bone health.
Sure. So, as we all know, bones are an integral part of our body. It's not just the skeleton that holds everything up or that protects everything, but it also helps us move. Our muscles are attached onto our bones. When we move our bones and the muscles move, or vice versa, that it really helps us not only maintain our structure, but also the function of our day-to-day routine activities. So if you look at it on a very, very basic way, that's the whole framework of our body. And that's where everything's positioned, the way it should be, the way it should move. Um, it's also one of the biggest systems of our body. If you think about all the different physiological systems or anatomical systems in our body, the skeletal system is one of the most profound by a lot of ways. The weight, the structure. So our bones are really a very important part of how we not only move, but how we feel in general, um, because of how important they are in our day-to-day life.
What affects bone health?
So there are a lot of things that could affect bone health. As you know, it's our bones are made of calcium, and a lot of times we'll see that as we're getting older, our bones are constantly reforming. I mean, they're reforming from birth, We're always having some bone added to our body and then some resorb. We call it, resorption and addition. So if a good way to think of it is, if you start out with the number five and then you add two and take one away and then add three and take one away, so you're constantly in this reshaping form, where you're adding some bone and you're taking some away as that bone gets older. But as long as that bone addition is more than the resorption, we keep growing. But at certain points, typically I would say in our mid 30s or early 30s, we start losing more bone than what we're putting on. So up until 30, whatever, or 30s, I would say roughly mid 30s, whatever you have on there is your peak in terms of your bone density or the bone mass. And then it's up to you to really work on it to make sure that the loss of bone that you're going to have, it's not an if, but it's when, is to control it in a way that it doesn't affect your bone density or your bone mass or your overall health. Uh, so having your a right amount of calcium in your diet is extremely important. As we get older, our needs for bone deposition are more than when we're 10, because we're getting enough things, we're getting enough activity, we're getting enough calcium through, dairy, milk, or other sources. Uh, so as we get older, we want to make sure that the things that could affect bone health, like the amount of calcium or physical activity, are we be very mindful of those things. Other things that could affect bone health in varying amounts, is tobacco or alcohol use. Your gender, some males and females age differently in terms of your bone health. So it's very important to make sure that you're doing the right things based on your gender so that you're staying on top of your bone health. Your body mass index, people who are heavier tend to have more force going on to your bones, more stressors on your bones compared to people who are not as heavier. Your age, we know that as we age, our bones are going to be slightly less stronger than what they were when we were younger. Uh, your race and family history. If you have things like osteoporosis or things like other similar things in your family history, then that should tell you that you need to be a little more careful. Not that you always may have it, but that you should be careful about things like that. A lot of times, people even have hormone levels that could affect your bone strength and your bone density. Um, Certain medications are even known to have an effect on your bones, and they could cause them to get brittle. And so a lot of people, complain of having frequent fractures because of certain medications that they're taking. So it's really a multitude of factors that affect your bone health. And it's very important to kind of keep an eye on them as we get older to prevent any, unforeseen circumstances.
So you started talking about the answer to my next question, but I think we might be able to build on it. Why, in addition to everything you just said, is it important to focus on both bone health as we are getting older?
Uh-huh. So as we get older, bones are one of those structures that if something goes wrong with them, you could be looking at a lot more than just fixing your bone. You know, like if you have a cut on your skin, once you patch it up and it's healed, you're fine. Or if you have, some other sort of minor injury to one of your other systems, it could be localized. With bone, unfortunately, it may not be the case. For example, if we take the example of a hip fracture, let's say we have a 82-year-old male who who fell on an icy patch, landed on their hip, and then had a hip fracture. They go to the hospital. It's determined that it's a hip fracture. If it's something that can be fixed, then they would go undergo surgery. Or if it cannot be fixed and it needs to be replaced, there are certain uh, instances where replacement is the only option. Now, if you look at that whole instance, going through that recovery is going to mean, now you're going to have to go through surgery, you're going to have to go through rehab, you're going to have to go through medication changes, food changes, all these different things that could affect because of one bone being broken, uh, for a fraction of a second that you lost your balance. So even though they are one of the strongest things in our body, they could also become very brittle. So it's extremely important, and I can't stress enough how important it is to keep an eye on your bone health, making sure you're doing all the right things given the circumstances, to make sure that it stays as healthy as you can.
So, what can we do to improve our bone health?
Well, that's the million-dollar question: is what can we do and what should we do to improve our bone health? So first and foremost, as some of your listeners may already have guessed, is having an adequate calcium intake. As we get older, we tend to maybe cut down on some of the things that give us calcium. I don't know. Some people may be allergic to dairy or other things, and before we know it, we're not having enough calcium in our body. Uh, the National Institutes of Health, they say that between the ages of 51 and 70 years, um, males have a recommended dietary allowance of 1,000 milligrams of calcium, and females have a recommended dietary allowance of 1,200 milligrams of calcium. So between 51 and 70, females actually need more calcium than males do. But then people over 70 years of age, they both need the same amount of calcium, daily, which is 1,200 milligrams of calcium. Now, you can get it in a lot of different ways. You can have a calcium-rich diet, or you can have a supplement that gives you that amount of calcium. So that's one of the primary ways to ensure that you're getting the right amount of calcium in your diet. Or if you're not, then you can supplement it with medications or supplements. Another important thing is, vitamin D. We don't think of vitamin D as such an important factor unless you've been told by your doctor that you need to uh, take vitamin D. So vitamin D is that vitamin that we get typically, when we are in the sun, but not in the scorching sun. Typically they say early morning sun rays uh, that hits your skin converts some of that into vitamin D. Now, vitamin D is very important in helping our body absorb calcium from our blood. So let's say I took a 1,200 milligram pill of calcium this morning. If I don't have enough vitamin D, that 1,200 milligrams is not going to get absorbed from my bloodstream, and it's just going to go flushed out at the end of the day. So it's very important that not only do you have an adequate intake of calcium, but you have an adequate absorption capacity, which is helped by vitamin D intake. So, it's a good conversation to have with your PCP, your primary care doctor, to see if you would benefit from having a vitamin D supplement. If you're already taking a calcium supplement, ask them, do I need to take a vitamin D supplement, or, am I okay? Another important thing is adequate exercise routine. Our bones, they they do better when you put them to work. The bone, just like our muscles, if you don't use it, you lose it. We've all heard that phrase, you use it or lose it, which is true. If you don't use your muscle, your muscle would undergo what we call as muscle wasting, which means, your body will say, oh, well, Darshan doesn't really use this muscle, so I'm going to take this protein out of there and move it somewhere else that needs it. Or he's not using this bone. It doesn't seem like he's really walking that much, and he's not getting the forces through the bone, so it does not absorb the calcium that it typically would have. There's been lots of research that has shown that whenever you do any kind of weight-bearing exercises, it the pressure that you put on your bone helps you get your bones stronger. So, contrary to a lot of what people might believe that, oh, if I exercise, I might get hurt. It's actually, it might be the opposite, provided you do it the right way and you do the right kinds of exercises. Now, if you know that you're osteoporotic, I wouldn't recommend doing bench presses. If you can't do it above your capacity, but any kind of weight bearing exercises. So, one of the simplest weight bearing exercises you could do is, like a squat, a standing squat. If you're doing your squats and your feet are touching the floor, your body weight is going up and down. That's a very simple exercise where your body weight itself acts as a stressor to your bone, and in doing so, it makes it stronger. Uh, Other important exercises, simple exercise. And I want to stress that you don't really need to do anything fancy, or you don't need to have super fancy equipment in order to have good bone health. You could do simple exercises like walking or jogging, running, even stair climbing, things like that. Anytime you put pressure on your feet and it lifts up your body weight, gives enough pressure to your bones to then make that cycle where it starts getting stronger. So even if we have a routine of doing walks, brisk walking, or any kind of walking that we do as an exercise. Now, I would say I typically don't count, going to the grocery store and walking up and down the aisles when I'm shopping as an exercise. You want to dedicate a time that is strictly exercise, where you're not really doing it because you're doing something else. So yes, it's good to have those steps when you go to the local grocery store, but I would say carve out some time, 10 minutes, 15 minutes a day, where you're just going for a walk just to exercise. When you don't have any other agenda, you're just walking to exercise. Now, those kind of exercises help you improve your bone health. Uh, Another thing that you can do, is avoiding substances that could affect or may affect your bone health, like smoking or alcohol use or other substances that are known to affect, your bone health. So trying to avoid them or minimize their use could be very important in preventing or improving your bone health.
Are there specific dietary supplements or vitamins in addition to the calcium and vitamin D that are particularly important for bone health?
Um, those are the two that are really important. But a lot of people, if they have a bone density of lower than a certain amount, then their doctors might tell them that, okay, well, the regular 1200 milligrams is not going to cut it for you. Then you need to take X, Y, and Z, which could be a combination of calcium and other things. But that's a good question to have, or a good discussion to have with your primary care or your orthopod. If you see one, to determine if you need something on top of just the off-the-shelf dietary supplements. A lot of people have had needs to have prescription supplements, for lack of a better word, that are much more dense in terms of the nutrition they give and the calcium they provide. in order to have somebody heal quicker.
So, to check for vitamin D, is that a simple blood test?
So vitamin D can be checked with a blood test, and then the bone density. A lot of people, you might have heard people saying there's a scan. It's called a DEXA scan. So it's similar to getting an X-ray where you go through a scanning process, and they will tell you, the radiologist or the doctor who's interpreting it can tell you how strong your bones are, and whether you're osteoporotic or you're not, or you may be at risk for developing something down the line. So that's a very good scan to do if you feel that either you had an incident in the past where it was a small little fall, but you really injured your bones badly, or if you had history in your family where somebody had osteoporosis, or more than one person had it, and you feel that you might be at risk for that, talk to your doctor about getting a bone screen to make sure, if there's something that is relevant for you, then you can get it accessed.
So, we talked about tobacco use, overuse of alcohol, being sedentary. Are there other factors that can weaken bone density? And if so, how can we mitigate the risks?
Yeah, I mean, other than that, I feel being sedentary is probably one of the most uh, simpler but yet more complicated things that we come across. Simpler because all you need to do is walk around and do some basic exercises. Complicated because being such a simple task, a lot of people are still not able to do it. Let's think about somebody who, for other reasons, is bound in a wheelchair. They're wheelchair
Mm.
bound. They can't really get up and walk. So they'll say, yes, Darshan, it's easy for you to say, get up and walk, 20 minutes a day, but what if I can't? What if I'm in a wheelchair? So then it really becomes a challenge as to how you can modify the activities or the exercises you do so that you can still get strengthening. So there are a lot of exercises you can do seated or lying down that still would make your bones stronger. You just have to know the right exercises and do it, with or without supervision, depending on your situation.
As far as the sedentary lifestyle goes, I heard or read something somewhere that said sitting is the new smoking.
Oh yeah.
So, however many years ago, smoking was so many people were doing it, and then all of a sudden, we knew what the risks were. People started stopping smoking or not starting, and now we just do so much sitting. Me included, I sit at a desk most of the day. So I really have to prioritize getting in my exercise before or after work so I don't fall into that sedentary lifestyle trap.
Absolutely. That's a very good point because a lot of people, seniors and otherwise, they feel that, oh, well, I'm not really sedentary. I catch the train, I go to work in the city, and then I come back and then, I'm doing chores around the house. I'm not somebody who sits around all day. I work 8 hours a day and then I, have an hour commute. But if you think about how much of that is real exercise that help you work towards your goal, it's a very small fraction. Yes, the walking you did in trying to catch the train, that is if you take public transport. If you're driving and you get into the car in your driveway and then stop at the work and walk into the office, sit at the desk all day, and then walk or drive back home, there's very little walking that you did. So it's absolutely right that sitting is a very dangerous habit that we shouldn't cultivate. Even if we're younger or more active, uh, even something simple as having a desk that allows you to stand up from time to time is very important. If, Not only in terms of your bone health, but also other things like your posture, your back strength, um, your neck strength, and the kinds of issues that you could have with your spine. We see a lot of seniors, who unfortunately, let's say uh, for physical disabilities, are in wheelchairs for a lot of time, or they love to read and they're sitting in their recliner and reading, 2 3 hours a day. A lot of people develop what's called a forward head posture, where your spine, your bones are moving forward because of this position, being your head in a position where you're looking at your nook, or you're reading your book, or you're knitting, sewing, crocheting, doing something where your head's down and sitting down posture. That affects your bone health. It affects your spine. It affects a lot of different things. And over a period of time, those kind of postures can really take a toll on how you move, how your bones feel, how your bones connect with other soft tissues in your body. So I think it's very important to incorporate short amounts of standing or walking, or just get off your desk or get off your chair, take a walk every 15 minutes or every 30 minutes, or just stand up if you have the ability to work in a place where you can do a stand-up desk. Not everybody has that, but if you are fortunate enough where you can do it that way, then do that. You don't have to sit 8 hours a day when you're working. You could stand up and maybe do marching in place, for 2 minutes every hour, or whatever you feel comfortable doing. But any kind of activity, any kind of weight bearing exercise that you can incorporate in your daily routine is extremely helpful in improving your bone health on top of other things.
Would you prefer to age independently in your own home or live in a nursing facility? I know what I'd rather do. Friends Life Care membership offers just that. Plan today for a future lived at home with vitality, independence, growth, and resilience while protecting your savings. Learn about your options at a free seminar or webinar. Register at friendslifecare.org/register or call 215-628-8964. What are some common misconceptions people might have about bone health?
Well, one of the biggest ones that I come across is, oh, if you just take calcium supplements, you're fine. You don't need to do anything else. The calcium that I'm taking is enough to get my bones strong, and even if I don't do anything else. So a lot of seniors, they'll take their pills or their supplements as directed, but then not do anything on top of that. The physical activity part, which is just as important as having the right amount of calcium intake, because if you don't have uh, that physical activity that's going to make your bones stronger, having all that calcium just deposited there is not going to be enough. Because as we discussed earlier, the calcium along with the vitamin D is going to help you absorb it. But now once you've absorbed it, you need to put it to work. You need to make it go where you need it to go, so that it fills up all those gaps in the bones that are getting, a little softer or porous. And that you can do by stressing your bones, and the bones will then ask your body for more calcium. So the calcium that's in your bloodstream will now be directed to that bone that is under stress, and that's how it gets deposited there.
So, how might chronic conditions such as osteoporosis affect bone health, and what treatment options are available?
Yeah, so osteoporosis, as some of your listeners may know, it makes your bones um, less dense. So if you look at a cross section of a bone, it's really a mesh. If you think about a lot of spider webs that are made of calcium overlapping on one another, that's what your bone would look like if you have a cross section of it. Um, and it's so dense that it holds things in place. When you have things like osteoporosis, that density of your bone and the minerals that are deposited in it is less. So now instead of having a spider web that is really dense, now you might have a web that is like that, so which gives you more space in between, which then makes it more susceptible to breakage. Because based on your bone mineral density, it can take certain amounts of loads or certain amounts of activity or certain amounts of incidents like falls. A lot of people fall, but not everybody has a fracture.
Mhm.
So that has to mean something that, maybe the person who fell and didn't get a fracture either didn't have such a bad fall, or their bones were stronger than the ones who fell and had a fracture. So and it's not as simple as that when it comes to that example, but that's one way to look at it, is when somebody with osteoporosis has any kind of a stressful encounter, their bones are much more likely to break and much easily compared to somebody else who uh, does not have osteoporosis. I've even heard of instances where something as simple as just sitting down in a chair where you just flop into the chair and slam down, that is enough to create a stress fracture in people who may or may not have osteoporosis. So it's very important to not take a condition like osteoporosis lightly, because it could really mean a big difference in your quality of life. As far as the treatments, that's something that it's not very simple to answer and in the scope of physical therapy, but it would be a great discussion to have with your primary care and then your orthopod to come up with a solution that would fit right for an individual. Because there could be medications that might help you, but it may have some other side effects. So it's very important to involve your primary care doctor and your orthopod when trying to figure out what the best treatment protocol should be for you.
Can you offer advice for individuals who are concerned about their bone health but aren't sure where to start in terms of prevention and treatment?
Mhm. Yeah, so one of the easiest things you can do, like we mentioned, is exercising. And if you're not sure about how to exercise or what's the right kind of exercises, always talk to a specialist. You could contact any therapist or any PCP, but this is a good place where we could come in handy. You could contact us at Namaste Rehab, and we would be happy to do a screening for you, which would be complimentary, to see what is going on. Is there effects or is there symptoms that could make you prone to having an injury in the future? Or are there certain things that you're doing or not doing that could help you, get better? Or you may just be feeling really weak from the effects of bone mineral density loss or from other things. And it could be a matter of just having a good exercise routine in place that would then help you get out of that situation.
So, do you have any final thoughts on bone health before I let you go?
Uh, I would just stress on the same three things that I said: calcium intake, exercising, and just making sure you're doing all the right things as far as your bone health goes. Actually, I keep sounding like the drum beating over and over, but exercise and adequate nutrition in terms of calcium and vitamin D is the key to making sure that you have all it takes to have good bone health.
And hopefully, we get some nice weather coming up here soon so our listeners can get outside for some refreshing walking.
Absolutely. Amen to that.
Well, thank you so much for educating us about bone health and really what we can do to improve it. And just a reminder to our listeners to go back and listen to Darshan's last episode about home health rehab and physical therapy if you haven't done so. Thanks so much for joining me.
Thank you, Cheryl, for having me.
Thank you for listening to Honestly Aging by Friends Life Care VigR, a unique program focused on aging with vitality, independence, growth, and resilience. You can find links and show notes from this episode on our website at friendslifecare.org/podcast. Thank you to Darshan Bhatt for joining us today. You can learn more about Darshan and Namaste Rehab by visiting namasterehab.com and on LinkedIn. If you like our show, please rate, review, subscribe, and join us next time. To learn more about aging with vitality, independence, growth, and resilience, subscribe to our blog at friendslifecare.org/blog.